everyone. On the behalf of practicing consultants in the field of fetal medicine, I would like to congratulate Menogeno Labs Limited for curating a very sensitive non-invasive pregnancy test for detecting the RhD gene. This particular test has helped immensely in one of the cases which I have encountered in my practice. The mother was isoimmunized because of multiple plasma transfusions and no anti-D was given after the transfusion prior to the marriage. The mother had 2 fetuses lost because of fetal hydrops secondary to Rh incompatibility. We were in close association with that couple. We even did a preconceptional counseling for them, explained them the possible challenges which will be encountered in an Rh incompatible pregnancy. The couple were very confident about conceiving again, and they were ready for all the consequences of that incompatible pregnancy. Fortunately, during the same time, Menogeno Labs launched RhD Track, through where the fetal blood group was confirmed through a non-invasive test from the mother's blood. The Rh group of the baby was confirmed to be positive through this test. When we did the fetal blood sampling prior to intrauterine blood transfusion, it was B positive. So in our case, it was very useful and we were able to plan our management well ahead of time, even before we had planned for an intrauterine blood transfusion. Right from the 12th week of pregnancy, we knew that the fetus blood group is going to be positive because through the RhD track testing from Menogeno Labs, it was confirmed that the baby is housing an RhD gene. And we also knew that the mother was carrying only anti-D antibodies. And with the presence of RhD gene, we were knowing that the fetus is going to experience an anemic phase. This particular test was even validated by our case scenario because when we did the fetal blood sampling prior to intrauterine blood transfusion, it turned out to be B positive. So this particular test was very useful to us in planning our management, especially where there was a requirement for intrauterine blood transfusion. I thank the Menogeno Labs for curating such a beautiful and very sensitive test, which is very useful in the management of an Rh incompatible pregnancy. Thank you.
Menogeno try to provide innovative and relevant genetic tests for pregnant women. So our latest offering is the Rhesus D Track. For the first time in India, we can actually identify the RhD status of a fetus from the mother's blood. So this is relevant for Rh negative pregnant women, and only 10 ml of blood is required. It is non-invasive, well validated in the lab, and we are able to identify the RhD status of the fetus. So whether it is Rh positive or Rh negative. If it is, this helps in management of the pregnancy because clinicians can then decide if it is Rh positive. Of course, you would want to look at it more closely and give the relevant immunoglobulins and manage the fetus. But if it is Rh negative, you can, of course, it can continue as normal. And we believe that this test will be very useful in managing Rh negative pregnant women. Thank you.